everyone, it's Dr. Gina Joe, or Dr. Gina Jefferson, Professor of Otolaryngology, Head Neck Surgery. This week, my topic is on microaggressions in the workplace. This topic is relevant to both medical students and those of us already in practice. One of my friends called me this week telling me that she felt one of her junior faculty members were directing microaggressions toward her. He calls her boss, but yet and still he'll go behind her back to another colleague, voicing his issues in her leadership domain. My friend's experience is indeed an example of microaggressions. My friend is indeed experiencing microaggressions. These are brief verbal, behavioral, or environmental insults or derogatory comments about one's race, gender, or sexual orientation. Microaggressions are often unintentional, but at times may be intentional. I have 3 tips on handling microaggressions. Microaggressions impact us all differently, but they can contribute to adverse mental and physical health. So first, the challenge is determining whether or not, as a receiver of a particular microaggression, that it is one we would like to address. It is important to ask ourselves if we do address the microaggression with our family member, coworker, or boss, what the consequence might be. It is also important to ask ourselves if we do not say something, will we regret it? Second, we must determine how to respond if we choose to do so. Sometimes it is appropriate for passive response to the transgression, but often as the receiver of a microaggression, we are compelled to engage the person. Engagement permits an opportunity to inform how the transgression was perceived by the receiver. Sometimes it's necessary to ask the person to further explain what exactly they meant by their comment. But discussion can provide insight for the offender in a non-confrontational manner. Sometimes we commit microaggressions ourselves. Handling this requires some degree of self-awareness. We may witness the receiver of our comment look down or cringe. If we immediately recognize the transgression, we should verbally acknowledge it and apologize for it. If someone raises a point to us, then we should receptively listen. To avoid committing microaggressions altogether, it is best to watch the language that we use. I hope you found this brief video helpful. If so, share it with your friends and continue to follow me at Dr. Gina Joe.